Hi everyone, I'm Chevelle. I'm a board certified anesthesiologist assistant, and this week I'm covering more Q&As. So I had questions comparing CAAs, CRNAs, PAs, MDs, things of that nature. So I'll be covering questions regarding profession comparisons. So if you're interested in that, keep on watching. So someone left a question in my DMs and asked me if I'm worried about saturation, and they've seen saturation within PAs and NPs. And I would have to say that I'm not worried about saturation. The need for anesthesia providers is increasingly high. So it really helps to have an ACT model where you have CRNAs and CAs filling in the gap for areas that don't have anesthesia providers. Another thing is that the number of CAA states are growing, so there's more opportunities for CAs to go into new states and grow there. And as far as I know, when I was graduating, there was no shortage of jobs. Everyone had a job lined up on graduation. And there's still jobs that seek out people. I still get emails and notifications for jobs from my alumni network. So again, I don't worry about saturation. I don't think it will be an issue right now. There's more schools opening up, which is awesome because I believe it's going to help the profession grow, and there's going to be more states opening up. So I'm excited for the growth. I work in South Florida and I'm thinking of switching to the CAA path. However, I hardly see any CAAs. Only CRNAs. Are they treated the same in your hospital? Same responsibilities, level of oversight, etc. So there are some hospitals that are primarily CAA, some hospitals are primarily CRNA. So that just might be the case in this person's situation. My hospital is probably 90% CAAs. CRNAs are welcome at our hospital. We've had locum CRNAs that have helped us and they have been offered full-time jobs, but it might be a political thing, so that might be what it is in that hospital as well, where you just don't have CAAs working there. Are they treated the same in your hospital? I would say the CRNAs and CAAs were treated the same. We were all under the ACT model. There weren't any CRNAs that were running their own rooms without anesthesiologists, and that's the same thing for CAAs. We all had the same responsibilities. We intubated, put in lines, things like that. There was no difference in the treatment and level of responsibility. In terms of level of oversight, that will be something that varies per hospital. Some hospitals are more comfortable with the mid-level and advanced practitioner providers having more autonomy, and others will have anesthesiologists that will check in more periodically and be more hands-on. So that just depends on where you decide to work and things like that. But there's a variability on that aspect as well. Does the pay differ between CAAs and CRNA hospitals that hire both? Nope, they don't differ. As long as you're coming in with the same experience, they will not differ. Salary will be the same. Now, if you negotiate for a different sign-on bonus, then it would differ in that situation. But other than that, there should be no difference in terms of years of experience and things like that. We're all hired and paid the same. I noticed that pay can differ when looking at states, but I'm wondering if that's just because CRNAs can practice independently in some states. The CRNA independence practice, I believe a lot of the time they're still practicing under the surgeon. In some states, CRNAs can practice under the license of a surgeon rather than an anesthesiologist. So if you don't have anyone coming into that state and you need to fill the need, and CRNAs are filling in that need, then their pay may be higher, but you can also be in the Midwest as a CA and filling in the need for anesthesia in that area, and your pay might be higher too. I just feel like there's certain states that pay a higher amount in general because of the need for anesthesia providers and trying to attract people to that position. But yeah, in some states where CRNAs can practice without an anesthesiologist supervising them, you might see an increase in pay. I also want to mention that there might be some cost of living differences in cities like those in California versus a city in Florida where you don't have state tax and it costs lower to live here. So you might see higher salaries in a place like California versus Florida. Do you work with CRNAs? What's the difference between you and them? I have worked with CRNAs in my two jobs. I took a job for a couple of months. It was a transitional job. And then I have a full-time job in my current state of Florida, and in both places I've worked with CRNAs. There was no difference in terms of the anesthesia that we provided or the level of oversight. We both had the same autonomy, so there was really no difference. There would be a difference if, in general, if someone has more experience as an anesthesia provider. For example, if someone's been a 20-year CRNA, you might see a difference compared to a new graduate CAA, and vice versa. If you're a 20-year CAA, you could see a difference to a new graduate CRNA. So in terms of my experience with them, there was no difference. Anesthesiologists treated us all the same. Thank you. If you don't mind, could you expound on the differences between AA and PA? Any additional info would help me make a decision. Physician assistants are trained in a variety of specialties. They can go into orthopedic surgery, family medicine, internal medicine, psychiatric, sleep medicine, dermatology, all sorts of different kinds of practices, outpatient, inpatient. They could work online. That's a different kind of environment a PA would work in. And then in terms of CAAs, we are all working in anesthesia. Now, whether that's a surgery center, a hospital, a dentist's office, we are confined essentially to providing anesthesia. We're not going to a different specialty and, doing inpatient internal medicine. We are always doing anesthesia. So when we go to school, we focus completely on anesthesia. We do learn about medicine as a whole. We do learn about patients as a whole. Our focus is on the anesthetic implications of these different patient physiologies versus PAs where they're going to a couple of different rotations, a couple of different specialties. Even though what we study is from the anesthesia perspective, we still study cardiac, OB, peds, neuro, all kinds of specialties. We take in the full picture. It isn't a limitation since we incorporate all the different organs, specialties, and all the parts of a patient. We considered the added layer of anesthesia to all these different physiologies. To decide on whether you want to be a CA versus a PA, I would shadow both. PAs can work in all 50 states. I do believe that there is some saturation in that field, so that's something to consider. Field saturation, pay could be different. There are some PAs that make excellent money. I mean, you're still making six figures essentially most of the jobs, NPs, PAs, CRNAs, and CAs. However, I do believe there's more saturation in the PA field, and overall it seems like the average for PA pay is less, especially as a newer graduate. As a CA, I've talked about the numbers. I would definitely shadow more, again, both, to see if you like the patient interactions as a PA versus as a CA. And I worked with PAs and I thought it was great, and that's almost what I wanted to do, but I was someone that was very interested in pharmacology, chemistry. That was what I trained in and what I graduated in college with. So that was more of my preference. I'm also more of an introvert. I feel more comfortable as a CA. I'm taking care of patients for acute time periods. And I like the high acuity care. We take care of patients basically one day at a time. We meet them, we get to know them very quickly. We make decisions on how to do the best care for them, and then we meet the next patient. So I like that personally. It could be nice to have patients for multiple years, and that's something that you would have to decide for yourself. And that's part of the decision that I made into going into anesthesia versus going into the PA profession. Someone left a question, why did I choose the CA route over MD or the PA route? For my personal situation, my parents are a bit older. I want to feel more comfortable financially to step in and take care of them. That's something that factored in. I wanted to be in medicine, and I thought that all professions were great. I thought being a doctor was great, PA was great, and CA was great. And so I thought they would all provide me with what I wanted in terms of providing medicine. I was okay stepping back and working alongside in a team. The MD route wasn't my preference in the end. I was more so looking at the PA route. I was thinking about the MD route, but the number of years of school and the debt, personally, it didn't make sense to me when I could be a PA or a CA and do very similar jobs. Although I would be in a different role in terms of the team, I was okay with that. I didn't mind putting my ego aside and referring to someone and leaving certain decisions to someone else. I personally wanted a little bit more of a work-life balance. I felt like being a chemistry major was a lot, and doing all sorts of things to get into medical school and seeing the hoops that you always go through, even in medical school, to get into good residencies, and then beyond that, get into fellowships and the extensive training. I respect it, but I didn't want it for my life. I didn't see that in my life. I wanted to have more of a work-life balance. So that kind of ruled out the MD profession for me, the work-life balance aspect of it. Although I know there are people that have a work-life balance, personally for me, knowing how I am about things, I didn't see myself being able to do that in residency, in medical school, and at the start of my career as an MD. And then again, my parents are somewhat older, they're a little more unhealthy, and I wanted to be financially stable when it was more so time for them to retire. So I wanted to do something that was shorter training and still in medicine. So that ruled out MD. And then between PA and CA, I kind of covered this before, but I do like the high acuity of care. I like that we provide anesthesia for patients. I like the types of interactions we have with patients. I really enjoy that in anesthesia. We get to do a lot of procedures. We administer different medications that have a lot of different pharmacologies and different effects on the patient's physiology. There's a lot of problem solving, there's a lot of teamwork, and I really enjoy having students as well. So there's so much about this field that I've enjoyed over the past few months that I've gotten to work as a CA. I really am happy with my choice. I was working in an outpatient clinic as a scribe with PAs, and it was enjoyable, but I like the patient interactions we get as CAs. I like the procedures that we get to do. I like the learning that we get to do about the physiology, the pharmacology. That's all really fun to me. Although you could do a lot of fun procedural things as PAs, I was very happy going into the CA route because I was always interested in pharmacology as well. That's part of it. There's a lot that went into that decision. It felt like a really hard decision to make at the time. I'll go more into that decision in a different video, but that was part of my decision-making process. And I respect PAs, I respect MDs, I respect nurses, CRNAs, everyone that's part of the team, surgical techs, everyone. I think everyone has their role, and it's just up to people to decide when they get more exposure to both professions to see what feels best for them. So that was a good amount of questions. I hope that I answered most of the questions people had. If anyone has any more questions, please leave them down below. Of course, like, comment, and subscribe, and I'll see you next week.